You very much. Just checking you can hear me okay?
Very well, and
Okay,
we've got your slides up. So
thank you, thank you. Please let me know if the slides go wrong. Annie's already given a great overview of patient and public involvement in research, and that first definition is absolutely the critical one for us about working with or by rather than to, about or for them. But with public involvement, we're also interested in the impact it makes. And I think just following on from what Annie said about the application form, I think when you're applying as a PI, the other aspect of this to consider is not only the doing, but actually the capture of what you do and the reporting of it and the evaluation of it. And that's where I think in a way, health economists have a great deal to offer in terms of pushing forward on evidence generation as well as the sort of health economics component of this. So I'm going to tell you a little bit about our study, which looked at mathematical and economic modelling. But before I do that, I'm not sure if you've covered the reasons why we are interested in public involvement. And I think for modelling, this is really important. From a wider perspective, it makes research more relevant, more focused on the questions of importance for patients and the public. It can enhance the quality of a study. So, for example, ensuring a trial measures the right outcomes, which is pretty critical. But there's also a moral or ethical imperative, and some of the patients and public contributors we work with have this phrase of nothing about me without me, which is really important. But we also see democratic accountability to taxpayers, as well as the sort of fairness, accountability and transparency. And I think this is important to be mindful of because it can impact on the way you write a bid, the aims you have for your public involvement, how you work with public contributors and what sorts of outcomes you're hoping for. So for us, the MEMV study is an example of co-production in action, and co-production is the core concept that NIHR would expect you to be using when you put together an application form. And there is guidance on what co-production is and its principles on the NIHR website. But I just wanted to give you, in the short time I have with you, very much of a flavour of the MEMV study, because for us, this was an example of the potential of co-production in a complex area such as modelling. And we were part of the series in The Patient that was published to draw some of that thinking together. So our paper describes the process we went through. So I'll tell you a little bit about that. So MEMV is a study which is now in its second phase. We're a second opinion modeler for the Department of Health. That means we put together a model and it's compared to another model elsewhere, often public, as it was Public Health England would create the first model. We would be involved in the second model. And I think probably all of us would agree that it's public involvement in mathematical and economic modelling is not common. It's a complex area, it's full of terminology, it's full of concepts that require quite a lot of discussion. But it is important. And when we first started out, I think it was 2015 on the first MEMV, modelling was something that was talked about in sort of mathematical and health economic circles, and it wasn't talked about much publicly. And of course, in the last year with COVID, we've seen an absolute transformation of that. And modelling has been in the news. It's my modelling colleagues have been on the television and on Radio 4 and everywhere. So modelling has become a public good, if you like. It's been an area of discussion that public and patients are interested in. And the idea, I guess, is to provide that best evidence to reach a decision and about COVID, about vaccination. For us, MEMV, we were responsive to whatever the Department of Health asked us to model. So there were a range of models developed in different clinical areas, and we continue with that work, except, as you can imagine, the last 18 months, it's been very COVID focused. So involving patients and the public, our thinking was that, well, we were interested to know what could we do? How could this help a model? Could it enhance it? Could it improve confidence? And could it accelerate decision making? And when we started out, we were very fortunate that we had a policymaker at the Department of Health who was really interested in how the public can influence modelling. So he was supportive of us developing this strand of work. And I think when you're putting together your bids as health economists and you're putting in the doing of the public involvement, I would also encourage you to think about the innovation within your work and how can you find out how public or patients can contribute actively to your work, and maybe include studies within studies to address that question. I think that's an area that would be great to see grow. So when we worked with what we I guess came out in terms of the key outcome of MEMBI was a framework, and this identifies the nature and the type of public involvement, and the idea is that it will guide future models. It identifies the values that our public contributors brought to their discussion, and that's really important to understand. And I mentioned some of the sort of generic values we see in public involvement, but there were specific ones to do with modelling. So that is really, really key because it can influence the way people interact and the things they say. We identified the conditions for implementation because our public contributors felt that we were working in quite a rarefied atmosphere. We had a modelling team with health economists, with mathematicians. We had me as the PPI lead. We had our public contributors. And we were thinking a lot about how to implement our thinking, but they pointed out that in many teams, you won't necessarily have that mix of expertise. So you need to be clear what conditions are required to implement this sort of thinking. So that helped us to really think through how we draw together the values, what the conditions for implementation are. And as we moved forward, we ended up developing two different forms of the framework. If you look at the paper, you'll see there's a short form version, which is a summary of the steps of modelling with the epidemiological steps on one side and the health economic steps on the other. And it's a broad grouping, sort of thematic grouping of what patients bring to that process. And for those people who are really keen, we have a long form framework, which is very, very long. And that takes each specific step and thinks through what that contribution looks like. So it's a much more detailed assessment. And what did it involve? How did we get there? Well, this was pre-COVID, the development of the framework. So we were lucky that we were able to meet face to face because it's a challenging topic to discuss, and particularly when you're trying to create a deliberative dialogue. So over the 5 years of the first MEMV, we had 21 meetings. And remember, this is a bit different from the public involvement, the doing. This is about working together to co-produce a new understanding of potential contribution. So it's a bit different. Each meeting lasted between 2 and 3 hours. As we moved through the project, we became, the public contributors wanted longer meetings because there was so much to say. And at that point, they had learned so much about modelling that they really wanted to put that into action. And we sort of conceptualized it as a deliberative knowledge space, what we call a deliberative knowledge space, which means that the team would present on a method or a concept. The public contributors would have a chance to learn about it, to ask questions about it, and to reflect on it and ask questions like, why are you doing it in that way and not in this way? Why are you making that assumption in the model? What's the basis for that assumption? That's not how society works. So why are you doing it in that way? So there was a sort of dialogue and a challenge, and it wasn't about the public contributors providing an answer based on their own experiences. Usually it was more about them triggering a thought or a conversation which led the team to go off and, for example, find out about different sorts of data or how they were, the granularity of the data they were using. So they were evolving discussions, and you know, for us it was really important. People felt able to challenge the basis for the data collection, and we did things like when we had the NatSal survey of sexual behaviours and attitudes, we used that for one of the models for HPV, and the public contributors critiqued the original survey and the nature of the data it was collecting, which they felt was using concepts that were quite old, because the focus of NatSal is on replication and application of the same questionnaire sort of each time. It meant that it was holding concepts within it that were sort of tacit and the public contributors didn't feel represented modern society. And we fed that back to the NatSal consultation. So the group were very active in trying to push on other fronts as well. So, but the important thing for me, and I think Annie picked up on this, was we wanted to create a safe space. We wanted to make sure everyone felt safe in that interaction, that no one felt personally got at or criticised, that this was about a sort of a greater good. And that meant that meeting together, sharing lunches, you know, and having time together was really important. So over the course of these meetings, we developed the framework, and it was a very much a co-production with me writing things down, feeding them back, and the group commenting and shaping and moving it forward. So we had a lot of iterations of the framework as we moved it forward. So just to give a sense of some of the comments from the project, you know, so one of our public contributors, this was from the paper, and they asked us to put in some quotes. So we now have a picture of what public involvement looked like. Sorry, that was a slight error there. So we had no roadmap to guide our journey at the start. We also had, sorry, this is obviously a spell check. No idea of the constraints we might need to work within. The researchers we were working with had no idea of what they wanted from us, which is true. We started out on a journey of exploration. I think that's important to keep within your project as well. And we didn't know what they would add to the model. So the first year felt like we were working in the dark, not even sure what we are trying to achieve. And I think when you're trying to develop thinking around methods or concepts, it can feel like this. And I think that's okay, because it's got to start somewhere, and you have to create the space for these discussions to happen. And then a key breakthrough was the pictorial representation of what happens in a model. And so, having spent many meetings trying to figure out what modeling was about, the public contributors suddenly felt they could understand it as a process, and we had a framework that we could start organizing our thoughts around. And I think this is quite rare for, excuse me, for people to present these things in a framework in this way. And then one of the academics who was one of our modelers, just to pick out that middle bit from my perspective, being given this opportunity to convey the work to public members through reasoned discourse, ensure justification of modelling aspects, aiding model integrity and validity. So there was the direct feedbacks into their thinking that they took away. So just to summarize MEMV, what it includes, we have the context for implementation as a big table, what you need to have in place for it to work. The values that underpin public involvement in modelling. So again, drawing on those to help you think through your aims and how it will work. We have the short form summary, which is in the paper, and then we have the long form framework, which you need to click through to, because it's so big they wouldn't let us have it in the main paper, so you just need to find it through the link. So just to conclude, our framework is ready for application and refinement. It shows that public involvement in methodologically complex areas such as modelling is feasible, absolutely feasible. But it's been more common in the content of research, the experiences people report. We've seen less development in methodology and concepts, and I think that's a really important area for us to develop. And I'd really encourage you, as you move through development of your bids as PIs, that you're thinking about the doing of PPI, but also understanding it, capturing it, reporting it well, and then being able to contribute a paper on your PPI and enhance our evidence base, because it's developing, it's weak in some parts, but it's moving forward quite quickly. A lot of papers being published. So the other aspect of this is that it is quite rare. So as you're writing up your application, being able to tell the panel that this aspect of work is important but rare is helpful for them. So where we're at is that really we are poised to start testing out aspects of the framework, and because of COVID we haven't been able to do that as much as we wanted, because other things have overtaken us, as you can imagine. So I think that's going to be our sort of next step. Once we know what our next project is, we'll be taking the framework and starting to explore some aspects of it. And really, we want to really strengthen that evidence base. And I think we need to also recognise that funders, including NIHR and others, can build in this element of methodological development. So I will conclude there. And please do get in touch if you would like to know more.
Sophie, thank you so much. Again, there's lots in that that I